have an industry presentation on SAS Analytics by Shri Prashant Rai, Senior Business Solution Manager, SAS India. He is a domain expert for SAS in public healthcare and insurance who is engaging with customers across central, state government and insurance companies in India. He leads the analytical efforts for SAS that won fraud management programs with some of the largest central state government healthcare programs. He works as an expert in application of path-breaking artificial intelligence and machine learning use cases with Government of India. I request you to please take over, sir. Thank you.
So hello and welcome everyone. In fact, the last panel discussion, connected me the topic where I wanted to come. So the esteemed panel left their discussion on digitalization. So digitalization as a concept is very interesting, and I think in the last 1.5 decade, our country has generated tremendous amount of data. Now, as a concept, everyone knows that having a diagnostic report on the WhatsApp, decreases the time of travel. Or probably you may see the report quite earlier. You can click the link and could see the report, how the outcome of the diagnostic has come. But I think that is not the limit of digitalization. So if you can read your report, probably you can show it to your doctor, is the individual healthcare. And definitely the digitalization has revolutionized that part of the world. But do you think these PDF reports, or for that matter, those X-rays, computerized tomography scans, those can be read into the computer as well. So imagine a doctor, everybody is human being. A doctor may have seen thousands and lakhs of the tomography report in his entire career. But is it possible for the doctor to remember the structure of the area of interest? Probably not. A CT scan which may have come before the doctor probably a week ago may have one tumor into the tomography with a size say 1 millimeter. And probably n plus 7th day, he again gets the tomography report and he sees that, okay, there is no difference between the area of interest. Probably the same person who submitted his report a week ago, he has same area of interest. The tumor is same. That is where the advent of computing power has come and revolutionized this digital space. In fact, lakhs of the CT scans can be, extracted. The features of those scans can be extracted and made sense out of it. So you will be able to see that probably the n minus 1 lakh patient that you have seen probably 2 weeks ago had this character under certain circumstances having a particular symptom, and how those symptom has progressed and how it is reflecting in next CT scan. That is the kind of invention or revolution which has come through AI. So in the next 15-20 minutes, I will need your attention on 2 distinct topics. One, how patient outcome has been revolutionized through the application of AI in healthcare. And second, because the paucity of time is there, so I have picked 2 use cases which we have implemented across the globe as an organization in the healthcare space. So starting with the presentation, these are the 5 areas. Probably when we were talking about the public healthcare, knowingly, unknowingly, we talked about all these 5 areas. First is resource management. And we all know, in a country constrained with the resources, if we can apply something which can make doctors and patient relationship, which is effectively one-to-one right now. So a super specialist sitting in one hospital in Hyderabad can attend one critically ill patient. But can we make this relationship one-to-many? Is it possible for multiple patients to send their diagnostic? Is it possible for multiple patients to, narrate their symptoms? And is it possible for a doctor sitting into Hyderabad treat a patient up to certain extent in Warangal? Or for that matter, he can treat the patient in Chennai as well. So is it possible to augment the resources? Is it possible to augment the human resource as well as the infrastructure of the health through AI? I'll show you how. The second is population healthcare. Everybody talked about population healthcare, and I think post-COVID era, we all realize how a technology in population healthcare can save millions of lives at a time. Clinical decision. I mean, again, in post-COVID era, most of us would realize that, I mean, had it been a normal world, the vaccination of COVID may have taken years to get invented. But look at the kind of work they have done. They have been able to, invent the protein-based vaccination within, say, 6 months or 8 months. And it is being, distributed far and wide across the country as a, protection against this virus. So clinical decision in drug discovery. Then disease surveillance. Somebody was, esteemed guest was talking about the surveillance of the disease. I mean, in a world which is growing tremendously in terms of population, we have Earth reacting into different ways. I mean, the weather is changing, the water is changing, the environment is changing. The relationship between population, the relationship between the character of the Earth is not linear anymore. It has become absolutely non-linear. So how those existing diseases are mutating, straining, and where the new diseases are coming. It is imperative for the public, for the government, and public healthcare at large, to detect the advancement, the strain in the existing disease and advent of the new disease. And last but not the least, public policy planning and, evaluation. I mean, the government is choosing to invest billions of dollars into the healthcare. And it is rightly being done. But do we have the technology to measure the impact of that billion rupees or $1 billion? Because, in no point of time in the future, there will be a day when we will have sufficient money, sufficient resource to spend on the larger population. So there should be millions of hypothesis testing that has to happen to measure the impact of investment. And these 5 areas, in fact, in these 5 areas, in fact, AI is making rapid progress. Now, all these are concepts. Does it translate into the real use cases? Are somebody working on this? The next slide talks about it. Look into this. These are the top 6 areas in which AI is making rapid progress. The first of it is medical imaging. I mean, just to let you know, and probably all of us know that, the mathematics behind artificial intelligence is not something which is very new. I mean, if you look into the advancement of mathematics and statistics, probably 18th, 19th, and 20th century, the mathematics advanced itself more rapidly compared to 20th century. So you will see a lot of mathematicians from those era, all the algorithms, all the theorems, corollary, all the validations. Those are all, the most important mathematics, which is the relationship between energy and mass, was discovered probably in the middle of the 20th century. What revolutionized this space? The revolution came into this space in the last 20 years since the advent of computing power. The mathematics was put together with the computing power, and that is the origination of artificial intelligence. And the case in point is medical imaging. As I told you, for a doctor or for someone, anyone, a pile of 1 lakh CT scan, 1 lakh USG, 1 lakh X-ray doesn't make any sense probably 10 years ago. It was absolutely nonsense. Okay, this is a pile of paper. But we knew that the pile of paper where these X-rays are, they are all in pixels. We knew it probably hundreds of years ago. We knew that these are pixels. These pixels are in fact a number. It is a representation of mathematics. Your face is representation of some number. If there is a variation in the pixel, you can extract the feature. We knew it. We knew it quite well. But we did not have the capability to extract those features because those matrix structure and the final, the feature had a lot of non-linear relationship. In order to extract any feature, we had to do a lot of calculation. That was not possible. The AI comes exactly at that point, where you can extract the feature of a medical document. You can figure out the abnormalities out of a CT scan. The CT scan is going to locate you exact area where it compare and how it comes up to this conclusion. It can relate lakhs of images. It can compare the current image, and it will tell you that compared to the image which I have seen in the past, this is the abnormality which is there. It can detect the moving colors. I mean, in the cancer treatment, I mean, most of you, the experts, doctors are here. They know that shape and color are the important, point through which you identify the stage of the cancer. You take the decision in terms of where to go from here, what course of treatment you will take. That is where medical imaging has been revolutionized. Disease outcome. I mean, imagine a situation. I treat one patient at a time. I know the symptom. I give them some kind of treatment. But imagine a situation where I have complete life cycle of say 2 million patients. You have the profile of those patients, and you have the intervention that you had taken in the past and what kind of outcome it generated. Now you have new patient. You can compare the profile of that patient with the current patient with the average profile of the patient, 2 million patients who have come in the past. You know what kind of intervention I have given for this profile and what intervention resulted into the betterment of the quality of life. That is the kind of impact AI and machine learning is making. Precision medicine, again, these two are the connected topics. Drug discovery and development, virtual assistants. I mean, in the last 3 years, this space is again very revolutionized. We lost 500,000 people in the COVID in the last 3 years, reported. And then I think double of that unreported. The most unfortunate part is that we lost thousands of doctors. We lost thousands of paramedics. A report says that if virtual assistants or telemedicine could have introduced at that time, the mortality could have been reduced by half. So we could have saved this precious resource. I mean, being a doctor in India is itself precious. The proportion, the weight of one doctor is probably 14,000 per person across the country. So we could have saved multiple lives who are very valuable if application of AI in virtual assistance and remote monitoring could have been introduced. So these are the 6 areas which is the use case currently for the AI and ML. Moving forward, I will take your time, a minute on how medical imaging is being used. So, as I told you, medical imaging works on the concept of feature extraction. And feature extraction is about locating the right point into the entire, the report, whether it is X-ray, whether it is, USG, whether it is CT scans. So, those are the data set for the medical imaging. Second, what intervention you can get out of it? You can really locate. As a human, it will not be possible for you to remember all your interventions that you have done on multiple patients in the past. Probably you will not be able to remember the abnormalities. In fact, in a complex structure of CT scan, you will not be able to locate the abnormalities. And then there are multiple reasons for it. Medical imaging through AI is going to give you that capability. And how it has helped? It has reduced the diagnostic error by 80% for some of the diseases. And when I say 80%, you can measure the impact of this 80%. A wrong diagnosis, a wrong prescription, a wrong prognosis can lead to disaster. So when I say 80%, it is a big number. It reduces the reliance on the human intelligence. I'm not saying, in the last discussion, ma'am was saying it is absolutely not possible to replace human with artificial intelligence, and that is absolutely correct, 100% correct. It is only possible to bring artificial intelligence closer to the human. Never it will be the case that, it will be possible that your entire detection, prescription, prognosis, all will be handed over to the, artificial intelligence. But there is a possibility that we can improve it. Disease outcome and precision medicine. We have done this exercise at multiple places where if you bring together all the different data sets, probably the physiological data, probably the socioeconomic data, climatic change, most importantly the genomic data. If you bring all this data together and then you have the course of treatment with you. So for example, I am Prashant Rai. Where do I live? What is my demographic profile? What is my physiological profile at the different health touch point? So for example, respiratory rate, cardiac pattern, oxygen saturation at different health touch point. Then you have my socioeconomic data, how much I earn, how I live, where I live. Then you have my genomic data and what treatment you have given me under certain circumstances. I came with N symptoms. I came with Y symptoms. What intervention you did and how that intervention led to the better quality of my life. If you have these data, this is called patient outcome data. If you have this data in store, you can take better decision. Third is precision medicine. So as a doctor, I'm not a doctor, I assume that in a situation where a patient comes to you with certain kind of symptom, he narrates the system to you, and in your mind, there are 10 possibility which emerges for the course of treatment. Okay, should I go this way? Should I go this way? Should I go this way? In a critical situation, the success rate of each course, if you are thinking 10 ways, is just 10%. Then another technological advancement is diagnosis. So you suggest some kind of diagnosis. And then you reduce that 10 different ways probably to 5 ways. You say that, okay, those 5 hypotheses are incorrect. Let me treat this patient 5 ways. Suddenly, that 0.10 probability of the success of that way increases by 100%, which becomes 0.20. But is it possible to reduce it even further? That is the work of the precision medicine. You have got 5 ways right now, according to the symptom of the patient. But if you have got the profile, if you have got enough intelligence, you can reduce your 5 ways into 3 ways. And look at the dramatism of the probability. First, the success rate of each route was 0.10. After diagnosis, it increased to 0.20. And after precision medicine, probably you are sure that this patient belongs to a particular cluster. I had given treatment in such a way into that cluster, and if I give this medicine, probably the quality of life will be better. And now probably you are done with the 3 ways or 2 ways. Look at the probability transmission. 0.10, success. In second case, 0.20. And after profiling and precision medicine, it increases by 0.50. That is the kind of improvement you can make through AI. Next 3, I will take a very, very brief time. Drug discovery and development. In fact, and then I told you, the miracle that India witnessed. We have been able to, bring a protein-based vaccination in 6 months, 8 months, I'll say. 2 vaccines we have been able to discover. Was it possible, was it possible for the world to think about discovering a vaccination within say 8 months? Absolutely not. Vaccine discovery is a extremely tiring and complex process, and rightly it is complex. In fact, a medicine which was discovered in US is going to be consumed by someone in the Kerala. Now you see the diversity. Someone staying in US, he is a different data set. So a medicine discoverer will have to make sure that this medicine is going to take care of very heterogeneous environment. And that is exactly why design of experiment and the other laid out procedure for the disease discovery takes a lot of time. There are thousands of hypothesis testing which has to be done before putting a drug into the market. There are multiple non-linear relationships between your hypothesis. There is a limitation of human mind in terms of thinking the hypothesis even. How many hypotheses that you have? Out of all the experience which you have personally and you can collect from the outside, probably you will have 800 hypotheses. But this world cannot be clustered into 800 pieces. The fact is this world is huge. So the idea is, the objective is to make the drug in such a way that if it will be consumed by the entire population of the globe, at least it should not impact the person negatively. And there is a limit of it as well, which we say side effect. There is a threshold of side effect, which has to be maintained while the drug discovery. To the the application of AI, the hypothesis, the impact and outcome, all the linear relationship and all the non-linear relationship, a good AI application can create 1 billion hypotheses out of 800 long data set. Can you imagine a situation? And then all these can be tested within a half second. And that is where AI has revolutionized this space of drug discovery and development. I talked about virtual assistants. I mean, it will be imperative in some point or other in the future where we will have, the incremental rate of super specialist production. You increase the super speciality in health space at a certain pace. You cannot accelerate it the way you want. You have limitation. You do not have all the intelligent student. So there is a limitation with which you can increase the number of doctors. There is a limitation up to which you can increase the number of super specialists. And increment in the population is immense. So no point in the future you will have the situation where you will have optimal number of doctors for all the population. So the traditional method of the treatment where one doctor and one patient is engaged at a particular time, you will have to create a situation where this relationship of 1-to-1 could be converted into 1-to-many. And the AI is helping the healthcare doing that. And then remote monitoring and telemedicine I talked of, we have utilized it up to certain extent during COVID, but there is a huge potential. And the way digitalization is growing, probably it will reach up to the different level probably in 2 years. So wrap up this section with a very alarming report. All of you can access NHS UK, National Health Scheme, where we are working. They have created the cancer repository for London, and they are predicting that in next 1.5 decades, and it's their report, every second person in London is going to collide with the cancer some way or other. Now imagine the situation. The only way in which we will be able to tackle that situation is we will be able to discover some kind of medicine. Second, we will augment the care. We will identify the cancer earlier. We will be able to decide the diagnosis, prognosis. We will be able to decide the way of treatment much faster with greater accuracy. And that is where the next part of the world is going to revolutionize this space through AI. In the next few minutes, I will talk, all of which I talked was concept and use cases. Here are some of the statistics. And this will get you a clear idea that AI is not a mutiny, rather it has become a tempest and it is knocking your door. It is at your peril that you are ignoring it. So the report says that medical error in diagnosis has come down by 85%. And treatment error has come down by 38%. I gave you the continuation of probability, 10%, 20%, and 50%. Improved diagnostic discovery. So this report is from the skin cancer, and those who know, the doctors know skin cancer way better than me. It is all about pigmentation and color. So there is an increase in accuracy by 95% in identifying early skin cancer through the application of AI. Similarly, increased efficacy in radiology. A company in North America has been able to discover the medicine for fibrosis in just 4 days. In just 4 days by the application of AI. Similarly, there is a tremendous application of AI which has brought quality care in the area of personal treatment plan and efficient resource allocation. From here, just 2 slides, and because the constraint of the time, I have cut down on the slides. I have some powerful implementations in India as well. We have done some powerful work in Indian health space, but I will talk about 2 healthcare cases, one at the community level. And probably I have given, and this project is called Healthy Nevada, where objective of this entire exercise was to risk score every person of Nevada community based on the different data sets and predict as to for which disease they will fall in the future. So the government has clear visibility that what policy I am making, I know the risk score of every patient. I know the health profile of my entire population. So imagine an emergency situation, a pandemic, endemic. This will make government absolutely visible. They will take such a step which will have positive outcome, which will have maximum impact, which will have maximum, maximum reach. And how we did it? We collected the data. And we created those models. Ma'am was saying that doctor cannot be a modeler. Probably he cannot be a coder. So you will have to interpret the result in such a manner that a practitioner can understand it. Giving a probability number, saying that, okay, this person can fall to the cancer with a probability of 0.90. This doesn't make sense. This doesn't make sense absolutely. You will have to tell the practitioner that these are the problem, these are the issues, these are the health profile, these are the socio-economic profile, these are the genomic profile, due to which the probability of this kind of probability has, is there with the patient. It cannot be a mathematical relationship between a practitioner and a modeler. And out of all the implementation which we have done, it is the domain which leads the concert. We are the backroom boys. And that is how implementation of AI, has done wonders across the globe. So absolutely agreed on that point. So in Healthy Nevada, I told you the objective, and the data set was very simple. And this data set is available across the country. You have demographic data, huge amount of demographic data we have collected in the last 3 years during the COVID. We have collected socioeconomic data, we have collected demographic data, what we have not been able to collect probably, or we do not have facilities, the collection of genomic data, which plays very important role. And through that data, we have been able to cluster the group of patient. The government knows that if there is an explosion of obesity, which patient I should tackle to first. If there is an explosion of cardiovascular disease, which group of patient I should go to. If there is an explosion of mental disease, which patient is going to fall with that, what is the number of that patient, how much investment I should make. Those are the critical decisions which could be made. Last one piece, the Amsterdam UMC is the largest health cancer cure facility for the European Union. Through the application of computer vision, we have automated the detection and diagnosis of colorectal cancer. This program is going on right now into that department, and I will invite all of you, whoever wants to, be the part of this research segment. We look forward, to collaborate on these topics in India as well. So the objective over here for the UMC is to apply computer vision on the tomography scan and figure out the presence of malign area into the CT scan, which could be missed by, the human. And then this program has absolutely a successful track record. With this, again, I will, invite the research community working into the public and, personal health care. We are working on 20 killer diseases, which can turn to be a disaster for the humankind in the future. And we invite, sorry, the screen is over there. I have, listed down some of the effort that we are doing in cancer, but this is not limited. We have more than 200 researches going on in cancer and beyond cancer for other 19 diseases. We invite each one of you to get in touch with us. We can collaborate and make the healthcare space better through the application of AI. Thank you.
Thanks, Mr. Prashant, for this innumerous thoughts about the AI and analytics intervention in the public healthcare sector. It was really insightful. To thank you, can I request Prashant Rai to please come onto the stage? And can I request Dr. Shafqat Khan, Additional Mission Director, AB Digital Health Mission, Jammu and Kashmir, to please come onto the dais to give away a token of appreciation to Mr. Prashant Rai here.